maybe you don't want to sign up, but see if they have. It says
Yes. Hi, I'm Angie Anderson. I am the COPD program coordinator, and today we're going to be discussing exercise tips and a little bit about cardiopulmonary rehab. We have Diane Lewis, who is a respiratory therapist, and she is a coordinator for COPD Breathe Strong Foundation. And then we have Paige Stewart, who is a clinical exercise physiologist, and she is with the Cardiopulmonary Rehab Center with Sarasota Memorial. So welcome, everyone.
Thank you. And I think you were here the last time I was here. I want to say last.
Yeah, you gave that wonderful booklet.
Yes.
For the COPD.
And a matter of fact,
We have
okay, I start saying, and you have the new ones, Angela?
Yeah.
Perfect. So we've added to it. What we did is we also added pulmonary fibrosis because we're finding so many people,
My hubby.
there you go, that come to these groups either have or know somebody that has pulmonary fibrosis. So we're just now beginning to add some of that in, but just so you know, in the future there'll be more and more as we get, because we try to gather people such as this, the nurses, the exercise people, we try to gather information from everybody, so it's just not from a respiratory point of view. And so that's why, like I said, we start slow and we keep gathering and gathering and gathering. So, but you'll see in some of these books, and if you go to the page, and I'm upside down here, where it has the medications, you'll see the page becomes divided. And it'll say pulmonary fibrosis, or, see, I'm upside down, so again, I apologize. But you'll find it. I'm not
Sure.
taking time, but
I'm
yeah.
very good at books.
Yeah. So, and I don't know if the pages I have here included. So anyway, we're going to go through a little bit of this, but basically we're going to give most of the time to Paige because she, being an exercise physiologist, knows much more about these things than I do. So, welcome though to you all. This is our new guide, like we said, which we've just made some changes to. Breathe Strong, and I think most of you all are now familiar with Breathe Strong because Bob's been here too. Bob and I are like partners here in Florida, and we kind of travel the whole state and sometimes even to other locations. But basically we talk about anything that's going to help patients. He likes to say connecting, engaging, and empowering. And I like to say healthy, happy, and out of the hospital. Right? Put it in basic terms here. So anyway, it includes a variety of things. Breathing exercises, which we're going to talk about. It talks about our COPD medications. Again, we have a good section in there on the COPD medications. Several pages of information, and like I said, that's one of the areas we do have it divided up into COPD and pulmonary fibrosis. Working with your doctor on an action plan. Sometimes, you know, you may want to make suggestions, talk to your doctors about cheaper medications or alternatives to some of the medications, and so we have an action plan in here that you can use as a form to ask questions, talk to your doctor about. Portable oxygen. This is always one of the big topics when we come to a lot of these meetings. Now I see that nobody here at this time is on oxygen. Are you ever on oxygen? Are you on oxygen at night? No. Good for you. Good for you. Okay, that's a good sign.
Cookie question, if you don't mind. So somebody just told me being on oxygen with what do you call those?
The nasal cannula?
Yeah, that it's very painful.
No.
That the oxygen hurts the whole breathing tract.
Oh, no.
Wow.
Okay, you need to think about one or the other. Like I have had patients. I worked in the DME respiratory side of this for probably 10 or 15 years. And you would go in and you'd talk to patients and they were embarrassed, they were ashamed, they were this, they were that. And it's like, look at it this way. When your oxygen saturation drops, what happens is your heart thinks, okay, haven't done my job, gotta do more work. So pump, 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 pump. So here's your heart trying to compensate and trying to give your body the oxygen it's supposed to have. That can lead to all kinds of other problems. And when I especially used to talk to patients in the hospital who had had any type of heart problems or heart surgeries, I said, this is the last thing that you want to do. So, but no, it does not hurt. All it is a very, and they even make softer ones. They make some soft ones as opposed to just the regular cannulas. They also make earpieces if for any reason you become irritated around your ears. Some people may complain of dryness, normally here in Florida. If you're anything below 2 liters, 3 liters, or lower, because of the humidity that we have, you don't need a lot of humidity. If for any reason you do, your companies can always add what they call a humidifier to it, okay, which will add that humidity. And that humidity then will help with the dryness. The other thing available is they make a cream specifically for oxygen or patients who wear CPAP. You're all familiar with CPAP that a lot of people wear at night because they stop breathing. And it's made specifically because you don't want to use anything that's petroleum based. Don't want to use Vaseline, don't want to use KY jelly, because petroleum and oxygen is not a good mix. Now, you're not going to burst into flames, but it's just not what you want to do, okay? But there is that. As a matter of fact, they used to have it at CVS and Walgreens. Don't know if they still do or not. But they make a specific cream just for patients who wear oxygen or something. Okay? So no, you much rather use your oxygen, let your body take care of itself with the oxygen, than to go without when you need it. Okay? All right, portable oxygen, I think we talked about some last time in that and I don't even need to talk about it with you because you're not on oxygen, but some people have problems with getting the most portable system that they can. And that has nothing to do, unfortunately, with the companies that are out there. It has more to do with Medicare and the insurance companies. Okay? And Medicare is just cut reimbursement to the point that the companies are only providing you what they can afford to. All right, these people, Dr. Robinson is our medical advisor, one of the ones with the early beginners with Bob, who helped develop these manuals. I've been working now with them not quite a year, and we have gotten more input, more changes, more whatever. If any of you all ever have a chance to listen to Karen Diedemeyer, and she lives on the other coast of Florida, and she actually sits on, we are under the COPD Coalition COPD Foundation, and she actually sits on their board. She's one of their board members. Great speaker. She can tell you all kinds of tips and shortcuts and things, especially when it comes to getting your medication at the best rates and things like that. She's just a great speaker. This is the table of contents of the manual. Again, don't think I need to go over everything, but we talked about the action plan. We talked about your visit to the doctors. Okay? So a couple of things to look at when you get a chance.
Excuse me. Do you have this action plan available?
Oh, you want one of those? Yeah, right here. We've got some that Angela left for us. And those are the new ones. I just was telling them because we've added in, it initially was made for COPD patients. Now we've added in pulmonary fibrosis because they use a lot of the same things that COPD do. Okay. This one is just about management program, keeping you strong. These are the 4 main areas, you know, we try to concentrate on, as we already mentioned earlier. This is called a COPD assessment test. And I was just talking to Paige about it because we adopted this test. And patients can take it as often as they want. If you want to take it every time you go to the doctor, and it is in the middle, I think of this manual that you can use as a tear out. That's the portable assessment. Find the very middle for me. Is that it? No? Oh dear, don't tell me. It's in there. I'm just going to find the right page. See, I don't know the new ones as well as I need to. But this test as I looked it up and was trying to pull out, okay, what's really our best tests that are really simple to use, but give us the right information. This test is what they call a validated test, meaning that it's worth what you're doing. They have tested it. They have shown that it's a good test. It's very simple. There's only like 6 or 7 questions, and you just mark between 0 and 5. This is one. I never cough. I cough all the time. Okay, I have no mucus in my chest. My chest is completely full. My chest does not feel tight at all. My chest feels tight. And again, you're just putting numbers in there. When I walk up a hill or one flight of stairs, I am not breathless. When I walk up a hill or one flight of stairs, I am very breathless. I'm not limited by doing activities at home. I am limited doing activities at home. I'm confident leaving my home despite my lung condition. I am not confident leaving home. I sleep soundly, or I don't sleep soundly, again because of my lungs. I have lots of energy. I have no energy. And then you just total these up, and then this is what it means. A CAT score of 10 or more suggests you've got significant symptoms. You may want to call your doctor. Okay. A CAT score of 2 or more suggests a possible change in health status. Okay, not very significant. A worsening CAT score should be explained by exacerbation. Are you using your medications correctly and when you're supposed to? Are you using your inhalers properly? Or it could be a progression of your disease. And so you may need to make an adjustment in the therapy. So I'm going to find this when Paige is talking here in a little bit, so you'll have it, because we suggest, like I said, that you do it when you're going to your doctor. So, and then if he keeps a copy or if he keeps it, then each time you go in, whether it be every 3 months or every 6 months, he can see if you're progressing or not, or staying the same. Okay, this again, Bob, who's my partner, knew this gentleman. I did not know him well, so I apologize. But he is one of the reasons that this book was developed. His name was Nick Jones, and he no longer lives in the Villages. And I'm not going to tell Bob's jokes. They're not mine. Now, one thing that is in here, and matter of fact, you may have filled it out last time. No, you didn't. There's one lady here, remember, on oxygen, and she filled it out. But what this is for, we are trying to collect information on accessibility to portable oxygen. And what basically we're looking for is, like I told you, most of the time you're going to get a 3-foot tank at home, and you should have that in your home for your emergency backup. And then they should provide smaller tanks, depending on how high your flow is and how fast you breathe, will determine how small a tanks you can get. Most companies do not provide those. You've seen those nice little either pull along or carry concentrators. Most companies don't provide those. And as I mentioned earlier, it's not because they don't want to, it's just financially they can't do it. They can be purchased, and it's really what you have to have later on if you ever need oxygen and travel airlines. You're going to have those. So this is our way of gathering, and we're trying to do this over the next year. So we have information to provide the foundation and the coalition the problems that patients are having giving travel concentrators. Because you probably talk or see people all the time that may have them.
Yeah, just a question. My husband is not on oxygen. He has pulmonary fibrosis. But
good.
Sometimes he'll go through coughing fits. He'll cough 100 times an hour for 6 hours.
Right.
So he bought some, they look like thermos bottles of oxygen in plastic tubes. I think they supply 5 minutes of oxygen.
He bought them?
Yeah, commercial.
I'd be careful with that.
And they're kind of almost like a hockey mask or a CO, one of those
Like a CPAP
snoring.
mask.
Okay, now be careful, I'll tell you why.
Anyway, he opened one out of curiosity and in case he needed it. He's never needed it, but he tried one out and he said he noticed zero difference.
Okay. Part of that problem may be, anytime a person wears a mask, you have to run it at 5 liters or higher
5 liters.
per minute of flow. That's a lot.
Even if the person's inhaling?
Yes. Because if you don't have that much, it's not washing that mask of his exhaled CO2.
Oh.
Which
So
indicates
his-
our need to breathe.
Yes.
If you don't get all that air out, we don't indicate physiologically that we have to take a new breath in.
Exactly.
So you're shorting yourself more oxygen.
And so it's not washing that out, so he's not getting the oxygen that he needs. And if he has anything like that, tell him to be very, very careful about doing things like that. Okay. Because these, apparently they don't need any type of prescription if he just bought them outright. So he hasn't been really checked to see what he needs and what he doesn't need. And that includes when we talk about here, what's right is what's always at the tip of your finger when it comes to reading a pulse oximeter and knowing what oxygen you need. And so if he hasn't been tested by having his saturations tested and having a 6-minute walk.
Oh yeah, he has.
Okay.
And he has a pulmonologist. But I guess he saw it and he thought just in case because of that extreme.
Oh, so did the doctor write him a prescription?
No, you buy the stuff over the counter. You're an
Yeah.
oxygen junkie.
Yeah.
Buy it.
I wouldn't do it. I wouldn't
Okay,
do it. I'd be
I'll-
very, very careful.
Okay.
Because when patients, oxygen's a medication just like anything else that you take. And it's regulated just like any other medication you take. So that's like somebody telling you, hey, this lisinopril, which is a blood pressure medicine, works great for me. Why don't you try it? May not be the one you need. Okay? May not be the amount that you need.
In fact, I never noticed the oxygen bottles. And just by chance, somebody gave me a bunch of bottles of Febreze. And one night he's going to sleep, he's coughing a lot. I said, hand me one of those oxygen bottles, coughing so bad, just in case I need it at 3 a.m. And I handed him the Febreze, which container looked just, I might have killed him.
Oh, are they that small?
No, Febreze. It's,
Oh, okay.
they're both 12-inch bottles.
Okay, the bigger spray. I'm thinking of the little
Pastels,
ones.
covered.
Yeah.
Oh,
I couldn't believe how they could have gotten me from manslaughter.
All right, so anyway, that's what this is, and that form is in there. And that's the bottom half of the form. It's like I said, we're trying to gather information for the COPD Coalition. And I think, is this where Paige
This is
takes
where I
it?
start, yes.
And since I talked about several pages and couldn't find them as we were talking, I will find them, so once we are done,
We can get on going.
that's right. I can
Okay.
show you the right place.
Well, thank you.
Thank you.
So, hi guys, I'm Paige. I work at the Outpatient Center on Clark Road, which is powered by SMH. So I am one of the lead exercise physiologists in the pulmonary section on Tuesday and Thursday. So if you guys ever come to pulmonary rehab, you'll see my bright smiling face there. Lucky you.
Okay, what's your last name?
Stewart,
Stewart.
Stewart. I work alongside our registered respiratory therapist named Deborah North. She is my partner on Tuesday and Thursday with the pulmonary patients. And you may ask, what are we going to talk about? Well, exercise, obviously. That's my role in the whole entire ordeal, is to help pulmonary patients as well as cardiac patients on Monday, Wednesdays, and Fridays, 2 separate departments I work in, get stronger via exercise and weightlifting. Okay, so what we have to focus on here is starting a stable exercise routine in order to improve lung function. So walking is going to be your best option to start. Now, if you are not an avid exerciser, I do get a lot of people who said, well, I haven't exercised in years. Where do I start? Walk. I do recommend walking in the summers inside a climate-controlled area, such as University Mall, or even Sarasota Square Mall before they get rid of it. Hopefully that will still be there. It's perfect because if you go early in the morning, the air conditioning is on throughout the mall all day, but there's not a lot of people. You can make your rounds in circles. It's climate controlled. There is no humidity. You have places to stop and rest if you need to, such as benches and chairs. Okay. So I start there. I always recommend patients to start with an avid walking routine. Now, if you are capable of walking outside with humidity without having severe coughing spells or dizziness or fatigue, do that. Have your husband or wife go with you. Try to walk at least 30 minutes. Now, you can break that up into 3 10-minute sessions throughout the day, but your walk should be moderately paced. So you should be a little short of breath. There's different types of walking. There's this walking, which isn't going to do anything. And there is what we all know as power walking, which is I'm going to walk fast. I can't hold a very long conversation, but I am moving. My heart rate is staying up. I'm not strolling. Okay, so that's what we want to work on. A power walk versus stroll. Now, when we shop, ladies, I know I do this too. You stop and you go, skirt. That's really cute. Did you see that? You need someone to say, keep going. We'll see it the next time we go around. Try not to stop. Okay. For your first week, there are recommendations. Walk at a slower pace for the first 5 minutes to make sure that your body can adapt to the exercise you're doing. Now, that might be somewhat easy, but if you're someone who has something like COPD, emphysema, those types of things, that's going to be kind of challenging because you may have a coughing spell. You may have that phlegm trying to get up and you may need to stop. So walking at 5 minutes might be difficult, especially if you're very deconditioned. Okay? Let's talk about things to do at home, and then I'm going to go into the outpatient program a little bit more in depth. So in your packet are these exercises too. Now these are just general lightweight body exercises that are going to help keep your muscles strong, and they're going to help you pretty much learn to do things on your own and put you in the mood to do more. So once you do some of these exercises that are in there and you learn the breathing technique, you may want to say, okay, this is too easy. What's my next step? What do I do? Okay. So here, it teaches you the proper way to breathe when exercise. If you come to our outpatient rehab program, we teach you pursed lip and diaphragmatic breathing, okay, which should be your normal breathing routine. Okay, so you go in through your nose and out through pursed lips like you're blowing out a candle. It should not be, I should not be able to very hear it. Some people will huff it out like, that's too harsh. Oh, you need to inhale gently and exhale twice as long. What that does is it allows your heart rate to kind of simmer down if it's too high, which is going to take that force off of your lungs. Okay, so physiologically, if our heart, as Diane was talking about, is beating and beating and beating, we're taking energy away from our lungs. So we need to slow it down, get in control of our breathing, and simulate to our brains, I've gotten all the oxygen, the dead space out of my lungs, I need new air coming in. So that pursed lip and diaphragmatic breathing tells our brains how to breathe, because humans are lazy breathers. We mouth breathe. I'm guilty of it when I run. When I run outside, and I'm like, oh crap. Like I have to do it to make it a habit. And you should practice this when you're eating, bathing, doing any kind of daily activity. That's going to be the best way to train your body to use as much air efficiently as possible. Otherwise, we waste air. Okay? So, join a breathing club and get smart about COPD. That's where I'm going to go over what I do. Okay? So, join a gym. Okay? However, if you are on oxygen, which I don't see anybody here, gyms may not allow you to be there for the liability risk of the oxygen tank. Okay? If I were a gym owner and I had people coming with oxygen who could get lightheaded and dizzy, to be honest, I'm not sure that I would accept it either. But there are locations you can go to that you're going to be safe. The outpatient program that I work in, we get a lot of pulmonary patients coming who are on and not on oxygen but need to get stronger. So how do you enroll in that? Well, you have to have a pulmonary function test within that year for your pulmonologist to send a referral in. We would receive the referral, and you would meet with Deborah, a respiratory therapist, who would do an initial diagnosis on you, go over your medical history, ask about, you know, the difficulty of your breathing, any other symptoms or limitations you might have, and she does a 6-minute walk test initially. That 6-minute walk test indicates to me as a physiologist, how much stress your body can handle at that time with the oxygen level you're on, because you'll walk with your own system if you're on oxygen. You'll do a 6-minute walk test even if you don't need oxygen. Because what can happen when you're doing ambulation and exercise, your saturations may get below 89. And that's putting you at risk for shortness of breath, being dizzy, nausea, not feeling good. So that may indicate to us, if you do a 6-minute walk test and you at rest are 97% saturation, not on oxygen, but on a treadmill you get down to, we'll say 85, we need to prescribe you oxygen to get you through that stable routine. Okay, so that's why we do that. In addition, through the program, we recommend 30 minutes of aerobic intensity. Okay, so walking, biking, swimming. Swimming is very, very good. It's good on the joints. It's good on muscular work. And it also takes the strain off of the body if you're getting sore from walking. So if you find that your knees hurt, yes.
Are a 2 15-minute fairly intense as good as 30 minutes?
Yes. As long as it totals 30 minutes per that day, I don't care how you do it, just get 30 minutes in. Some people can only handle 10-minute bouts, and that's perfectly fine. But each day you should be working up from 25 to 30 minutes max. Okay? If you can do longer and you're feeling great, an hour would be the maximum I would say per day. Only 5 days a week, give yourself 2 days of rest. Okay? So some people say, I go to the gym 7 days a week. Why? Take 2 days off. Your body needs a chance to recover. Otherwise, you're utilizing so much energy from being sore that you're really not going to get a benefit out of your next session because you're tired. Okay? So when you are exercising, we're looking for 30 minutes of aerobic exercise 5 days a week. Right? 10 to 15 minutes after that should be weight training. Okay? Lifting things like soup cans at home, doing bicep curls. Or if you have exercise bands, you can get them at Target. You can find some at the dollar store, even some little ones. Look online for simple, if you Google light weight training, they show you pictures and things to do at home. But at home, you should be doing aerobic and resistance training together combined. Take 2 days off to rest and recover, and make sure you're drinking plenty of water. That's the one thing I found with a lot of my lung patients, they do not drink enough water. You need to be drinking 6 to 8 8-ounce glasses of water per day. Why do we do that? Well, if your lungs get dehydrated, they're not going to work to their full capability. And if you already have a pulmonary disease or struggle, having dehydrated lungs is just going to make it harder. Water is also very good because it helps us sleep better. It provides us, our joints, a little bit more H2O also, so they can function properly and keep us strong for our next workout. In addition, avoid sodium. Sodium can dehydrate those lungs again, making everything, all that water we put back in there, non-compliant.
2 days off. Sequential? Does it matter sequential or Wednesday, Saturday? Or?
It doesn't matter. It depends on your schedule, what you have going on. I like to take my weekends off. I recommend weekends off for pulmonary patients just because you have grandkids in town, you have things you want to do. It's nice to have 2 days off. It may take you a little longer to rest on your first day, or you might need that second day right after to feel really good. So, and there will be days where you're not going to get 5 days in because you're too tired, and it happens. But just make sure you're watching your diet also. So in addition to the exercise we teach, I'm going to talk about diet. Fruits and vegetables. A serving size would be the size of my fist, or the size of a tennis ball. Per day, you should be getting 6 to 8 servings of fruits and vegetables combined.
6 tennis balls a day?
Yes. Yep. So if you have a salad for lunch, that's about 3 because most salads are very large. Okay. In addition to that, if you have some fruit and yogurt in the morning, or your smoothie maker, perfect. You already have 2 right there. In addition to your salad at lunch, you're at 5. It's not that hard. You just have to remember to add something. And a vegetable at dinner, or even like peaches and cottage cheese for dessert. My mom does that. Peaches is perfect. Now, if you're diabetic, it's a different story. You have to watch that natural sugar with diabetes. And if you are diabetic and have a pulmonary disease, you should have a glucometer. You should be checking your blood sugar. That is so important. Okay. Any questions for me so far about that? Right. Anything else?
No, but what I want to do is, you do not have the list. one.
Thank you.
Go to the middle of the book. Page, I'll give you more too. Go to the very middle, and it'll be that CAT test that I mentioned. Okay, you see it? Right where the center. Okay, and then if you look on the back of that, right, you go right to the center where the staples are. Those, it's page. Oh,
It'd
doesn't
be
have a page number.
It'd be page 13 if it had a page number.
And you see, if that thing's pulled
Oh,
out,
okay.
then you've got the portable oxygen assessment on the back of it. Okay?
All
And
right.
then, when we were talking about pulmonary fibrosis, okay, page 2, how COPD is diagnosed and how pulmonary fibrosis is diagnosed. Okay, because there are some differences. And I think we asked this last time, spirometry. How many of you all have had spirometry testing, which is your pulmonary function, usually in your doctor's office or maybe here at the hospital, okay? Do you have them done once a year?
Yeah.
Okay, because that also helps tell you, you know, how well that you're doing. And I encourage you to look at those results and try to learn a little bit about them. I found out something very interesting the other day in that, as much as I hate to admit this, my husband is a smoker. I know, I've tried everything I can, but he's in one of these groups that he wants it to make him stop, and it's like, no, it doesn't work that way. When you decide you want to stop, then things are going to help you do it. And anyway, he went in to see his pulmonary doctor, had his pulmonary function test. He brings it home, and I'm looking at it, and it's like, oh, you're really doing pretty good. And then I saw, because a lot of times they'll test you, and then do they normally give you either an inhaler or a nebulizer treatment? That's a bronchodilator, because they want to see what your response is going to be, and if that helps your breathing get better, your tests get better. And when they had done that to him, it had minimal response. It wasn't probably 3 days before that he said to me, not going to get this order for Spiriva filled. I found out it's $300. So I said to him, after I saw the pulmonary function test, who told you to have this Spiriva? Because Spiriva is a bronchodilator. And he says, my primary care physician or my internal medicine. And I said, what? Did you not tell your pulmonary physician that she had ordered this? No. I said, well, guess what? You don't need it. So you need to make sure your primaries and your pulmonaries, and like I told him, when it comes to your lung disease, the pulmonary should take precedence over your primaries. Okay? When it comes to diabetes, when it comes to blood pressure, when it comes to your primaries are perfect. But see, he had just started seeing a pulmonary within the last year and a half, and even he didn't make that connection, even though his wife's a respiratory therapist and does these classes all the time. So like I told him, thank you, you just saved us $300. Okay, so look at those tests, learn how to interpret them, because it will tell you the results before and after. And that's what the doctors look at. That's what they determine if you really need an inhaler, if you need a nebulizer medication, whatever. All right, and then the next page I'm going to call your attention to is on page 5. And again, it separates the COPD medication and the pulmonary fibrosis medications. Again, something you can show your husband. Okay. That's page 5, and it's up at the top of the full page. Excuse me. Okay, see that? Because their medications are more oral. They're also expensive too, unfortunately, because a lot of them are still in what they call their, what am I trying, patent stage.
Beta.
Okay. Then if you go to page 6 and page 7, these talk about the different inhalers. And you can go through these pages. The first page are the 12-hour long acting. In other words, those are your maintenance. You don't use those if you're having significant breathing problems. They're not a rescue med. They're for maintenance. And then below them are the 24-hour long acting inhaler medications. One of the things I want to point out to you, see the little dollar signs we put by them? And then here's your guide. And this basically is telling you for, I think it's for each treatment, each dose, yes. Each dose, what this is costing. And you can go through there and look at, you know, what your different ones are costing. And then if you see the ones with the orange stars beside them, that tells you if they need to be used with a spacer. And I'm sorry, I should have brought some of those with me. Do you all know what a spacer is? Okay, good. Wonderful. And then the third page, on page 7, are the short-acting inhalers. These are your rescue meds. And again, shows you the same thing. Almost all of those need to be used with a spacer, except for the Combi Vent or the Pro Air.
No, I never use a spacer. Nobody ever suggested.
Oh, really? Well, it
Why?
depends on your medication. Did you find your medication
Yeah,
in this
Ventolin.
church? Oh, you take Ventolin?
Yeah.
Okay, then you might want to.
Only as needed.
Okay, well that's pretty common. Okay, because that's the rescue. Like you said, you only use it as you need it. You might talk to your doctor about a spacer. Now let me ask you, your doctor's office, do they have nurses and therapists or just nurses? Because the nurses there will know about it, what spacers are too. Do you know if there's any respiratory therapists? A lot of times the respiratory therapist will do the lung test. Not in every doctor's office though. Okay? So ask them about a spacer, because you can get some that'll fit in your pocket, like they're no bigger than this, and they'll fit in your pocket. So if you carry your rescue with you, that'll fit too. That just helps give you more medication deposition. You get it more into your lungs. It's not falling out into your oral airway in your mouth so much. Okay? Because they all are going to do that some. And you all know about rinsing your mouth after you use inhalers? Okay. Let's talk a little bit about the nebulizer medications. Do any of you use the nebulizer medications? You do, okay. That's not such a bad thing.
Yeah, when they need to.
Some people like the nebulizer. Some people, yeah, see there? Some people feel like they get more benefit from the nebulizer. And it's less costly than your inhalers. Okay? It's very inexpensive, but you can't get every medication in it. But your Part B, and they list them here, albuterol, Duonib, pulmonary court, Provana, Performist. Those are all covered by your Part B. So the expense difference is unbelievable. And like I said, some people like it better. So don't be upset or concerned if your doctor says, let's try a nebulizer, because there's nothing wrong with that. That's what we used to do for many years on almost all of our respiratory medications, until more and more and more of the inhalers started to come out. And they did that for convenience more than anything. Okay, now I'm going to flip back. Let's just see what else. Oh, doctor's visit. We talked about that. Your doctor's visit and plan. That's on page 12. And this is about asking your doctor and other members of your healthcare team pulmonary rehab. Ask about pulmonary rehab. Now, other than their pulmonary function test, do you know I've had people tell me what they need to qualify? They have to.
It has to, their FEV1 levels and
Okay.
the testing that the pulmonary function test does has to be in a certain range. I'm not sure of the range on the
Me
top of
neither.
their head.
I've
However, your
been told.
doctor would be able to tell you it qualifies within. You can even ask them. You can say, now when you get my test results,
Yes.
can you find out if I qualify for pulmonary rehab, if that's something you're interested in doing?
And it's absolutely awesome, and I'll tell you why. As Medicare changed their reimbursement, I'm just looking at my watch because I never want to go over. I'm one of these people, I'm a timely person. I want to start on time, I want to end on time. If we end early, yay, even better. But anyway, what was I talking about? Pulmonary rehab. When I was in home care, the DME business for years, I was one of the few, because I was in sales besides being a therapist, I did some of both. I was one of the few people like that though. When Bob and I, and this is where Bob and I, well no, we know each other further back than that, but anyway, Bob and I worked on 2 different occasions at 2 different respiratory DME companies. And at one location, believe it or not, we were so busy with patients, and this was back in the early to mid, maybe later 90s even. 3 respiratory therapists. And we did everything in the patient's home. We went there and helped them, instruct them on their nebulizers. We went to their home and set them up on CPAPs. We went to the home and set up some of the oxygen patients if it was by doctor request, or believe it or not, here in Florida, Medicaid. Medicaid patients are required that they be set up by a respiratory therapist. Not Medicare, Medicaid. So there were 3 of us at that time. As the years went on and went on, Medicare cut, Medicare cut, Medicare cut. You don't see a therapist hardly in the home with the DME company at all. There are a few home health agencies springing up that have respiratory therapists, but you got to qualify for a skilled service, meaning you need a nurse to come see you. You need physical therapy, occupational therapy, speech. You need something done in the home. And a few companies, not a lot. This is why I'm always singing the praises of our pulmonary rehab people. They have taken over between the therapist, the exercise physiologist, the nurses in there. I'm sure you have a whole variety of people.
Yep, we have doctors upstairs.
Yep.
So the hours that we're open, because we're SMH integrated, we have to be there when physicians are available for any 911 emergency calls.
So they're there, and they are the ones that have taken up the bulk of this education for the pulmonary respiratory patients. And they're good. And so that's why keep asking your doctor when you go and have your test if you qualify. Because these programs are so good. Now, under Medicare, you can only take it for so long. Again,
So it's a once in a lifetime.
You could only do it once, and I did it. a couple
You did
years
it,
ago, and I
okay.
can't, so I can't do it again.
It's a once in a lifetime program.
Which is too bad.
We were
It's
just talking. I was talking to Angela about it, the nurse, and she goes, "Why is it only once in a lifetime?" I'm like, "It beats the hell out of me."
Well, can I buy my own ticket?
Now
Can you pay for
You
it?
can pay out of pocket, however, it's very expensive. So if you are on Medicare in a secondary, 80% of the service goes to Medicare, 20% is your secondary co-insurance. So call your insurance and see what the likelihood of them paying most of it would be,
Yes.
and they can give you an affordable quote. We can't tell you that quote because our agency and the actual guidelines of the insurance always have 2 different communication systems going. They tell us one thing, we tell the patient. Turns out patient gets a big bill, they come at us and we said, well, we called. So now we have left it on the patient to know what their insurance covers, just to.
And sometimes on an individual basis, they will approve you.
But if you only have Medicare.
Oh, that's all you have is Medicare? Okay. That could change. I mean, to me, that's one of the things as they cut all these home services, I don't know why they then restricted this. Because to me, well, to me though, if you could go and just be monitored and exercise on an ongoing basis.
Now we do have a maintenance program that you could probably do.
I find out about about the clinic here too.
Yeah, so our maintenance program is at the same facility. Did you do it at Rand Road?
Yeah.
Okay, so that's where we have our maintenance program in the same department back there. Now, did you need oxygen with ambulation?
No.
Okay. Okay, so that would be the other thing. If you are someone who needs to be on portable oxygen, you can qualify for the maintenance program. The reason we offer that is because if you needed oxygen at a gym and the gym denies you, well, what other option do you have? That's not fair. You should still be able to exercise in a facility that allows that. So we let you use our oxygen. But
What's the name of the maintenance program?
it's the Pulmonary Rehabilitation Maintenance Program. It's through, we just changed the name of the building. Just call it Health Fit on Clark Road. It's a big white building that's next to
Oh, yeah, I know the
campus.
building.
Yep,
Oh, that's not,
yep, that's Health Fit.
Say that again. So I would possibly be eligible?
If you needed to have oxygen during, yeah.
Pulmonary rehab maintenance.
Yep. So you can pay, it'd be very similar to a gym membership, however, we would only let you do it if you needed oxygen while exercising. If you don't need oxygen when exercising, it doesn't count,
Oh, okay.
unfortunately. But ask about the rehab program and then find out from your insurance how much it would be estimate, because normally they can give you that quote after they run everything and tell you how much you'd be paying per session and what your monthly bill would be. If you meet your deductible, it's obviously going to be different, but we leave it up to the patient from there on out to make sure they understand their payments.
Okay, then I'm gonna talk about one thing, and if we have time, one more thing. Triggers. This time of year, you got a lot of pollen, okay? I can't speak for Sarasota up here. I live in Naples, and I live out off of an acre of land, and before that I was on 3 acres. And because we have so many trees around us, I would go out the 1st of February every year and cover everything on my patio. And then by the middle to the end of March, I would take it off, because if not, everything was yellow. You have so much pine pollen and other pollens.
And red tide.
Oh, red tide's horrible, especially down where we are. I don't think you all had it as bad this year, but
It's pretty
in the
bad.
Fort, oh, did you?
Oh, yeah.
Fort Myers, Cape Coral area, they had between red tide and then the green slime algae, they had almost, I would say, 7 to 8 months out of the year last year.
Wow.
Something.
Let me ask about covering your lanai furniture.
Well, I just did
Anti-pollen.
that so I wouldn't have,
But
so
the
what,
cover, don't the covers come up with pollen?
all they do use is sheets. I take them
If
off,
you have
roll
sunbrella,
them,
it's not as good. You
Oh, you
can
mean-
wipe it,
yeah.
but
I just cover them with sheets, then as I take them off, I roll them up, I try to collect as much of that as I can, and wash them. I just use old sheets.
Oh.
same thing when you dust in your house. Don't use one of those Swiffer dust grabbers, because I tested it with
Goes
sunlight.
everywhere, I'm sure.
Goes everywhere.
Yeah.
Although it shows the person shaking it. What are they shaking it behind? A white background.
Yeah.
So you can't see the dust. However, if you're going to clean blinds, wooden blinds, or bookshelves, wet a damp cloth and wipe that over to grab that so you don't kick up more dust. Now, if you're in the process of changing over your flooring, Berber carpet is the preferred carpet, or hardwood floors. The fluffy, nice, soft, cushy carpet holds on to dust and pet hair and dander, and when you vacuum it, it just goes up again.
So yeah,
tips there.
get to know kind of what your triggers are, or if you have any, if you've not been bothered by the pollens. But the pollens you can watch on your weather. When they give your weather a lot of times this time of the year, mainly of morning, but sometimes you'll see evening, they'll tell you what the pollen counts are, if you're high, if you're low.
Does pollen go up and down during the day?
It can, but usually it's more seasonal.
And then the wind too.
Yeah,
The
winds, and see, that's why on the East Coast, they don't have nearly the problem that we have over here, because the wind. They just have that great wind over there. I was just over there last weekend. I mean, just the wind is just unbelievable. And then the last thing that I'll just briefly mention, that maybe in the future when either Bob and I come up here to talk about, hurricane preparedness. You all aren't as bad as far as making long-term preparations, but if you're ever on oxygen, or would need to be, Those are the ones you really need to prepare. But even being a respiratory patient goes back to when these hurricanes come through, and I had a lady tell me this story. Last 3 years, I worked up at Health Park Hospital, Fort Myers, as a case manager. And she came in and she had, at least she told me it was pulmonary fibrosis. And she said she got it when the last hurricane that came through in North Carolina. And as you know, we still have houses in Naples that they have estimated it'll be out 5 years before these houses get repaired and get roofs. We finally got ours the day 2 Hurricane Irma last year. And anyway, she says, rather than wait, she and her son go into the home, because they lived right there on the beach, the coastal area, and started cleaning, taking things out, you know. And she says from then on, she had pulmonary problems. And that she's probably right, because when you have a hurricane, there is everything in there. Everything that has just, these houses, if they've been destroyed, all the things in them, it's there. Terrible tornadoes, same way. So, and the one thing she told me is, please tell your patients when they go through hurricanes down here, if they're going back to their houses, to wear masks. And it's not a bad idea even when you're cleaning pollens. Put on their mask. Because she says, I really believe if I had taken precautions that I probably never would have gotten. And her son had it and had already died from it. She says, I probably would not have gotten this. So it's just amazing, those things like that you have to look out for, but you do. We all do, but especially you. Okay, we're approaching our time. We've got a few minutes though. Is there any more questions?
Yeah, I'd like you, when I first came in, you mentioned something about portable concentrators.
Mm-hmm.
And I'm not sure what you said.
Okay, what it is.
The portable, the little ones to travel.
Mm-hmm. You have to have a travel concentrator that is approved by the, I just went brain dead. Yeah, it's not the airline, it's the FA, yes, thank you. Transportation Association. Ooh, I still can't think of it. It's there, but I can't think of it. Anyway,
And those
most
are
of them
covered by
are
Medicare?
anymore. Okay, no, and this is the problem.
What was your question?
Are they covered by Medicare? No. It's like yes and no. What's covered by Medicare is that they provide you with portable oxygen. Their portable oxygen can be that 3-foot tank. And it's come to that, as I was mentioning to them, because of the reimbursements of Medicare for oxygen use. Used to, when I first started out in, again, home care respiratory, we were reimbursed, we weren't, but the nebulizers were reimbursed in the home at a pretty good rate. Now I think it's $35 or something a month, $33 a month. Oxygen was $200 and some a month. Now it's somebody stated in this book 80 something. I think it's closer to 100 in some states. It varies by locale. And so they are only given so much for that portable too, and that portable's very little. So the companies have to look at what they can afford. If you want a travel concentrator, you know what those cost the companies? $2,000 to $5,000 for one. And so that's why a lot of them don't provide them unless you're traveling. And if you're traveling, they're supposed to do that, but you have to be aware that most of them you have to give a 2-week notice, the company, and say, okay, I'm traveling May 1st, I need my concentrator 2 days before, so at least I can learn how to use it, how to charge the batteries, etc., etc. You can work with your insurance companies. You can work with Medicare, see if they can help you with getting portables. But to be truthful, the companies usually will go with the tanks because of their cost, not because they want to create problems or hurt you all. It's just, there's just not reimbursement for it. And be careful about buying things online again. You really, if you decide to buy something, you really need to go to a reputable company, because you can get warranties. You can get from some of the companies, let's say that, okay, right now I only need 2 liters a minute, and it's only pulse, meaning it will just come on when you take a breath. But let's say in 3 years, okay, now I need 1-2 liters continuous. And so if that happens, then a lot of these companies that you buy them from, if they're a reputable company, will allow you to trade that one in and buy, or at least apply that to the model that you now need. So when you're looking, use reputable companies. Don't buy online, don't buy from friends, don't buy even though they may be trying to help you out and save you money, because that warranty is very important.
How do you find out that you're the reputable one?
Well, I can tell you one right
Because I
here.
looked online and there's a
It's
lot
hard.
of danger signs.
Oh, there are a lot of danger signs. We have, now this is one, and the only reason I know about it is it's just coming to Florida. Oxy Medical, it's called. It's supposed to be opening an office in Fort Myers in the future. Right now, they're like in 4 or 5 states. They're up in the villages, okay? But what they will do is, they will work with you and find out which concentrator meets your needs, okay? And then they will bring it down here or ship it to you. And they do this in Georgia, Arizona, Colorado. Like I said, we're hoping they'll open another one here. And there are more, and I will get more names and pass on to Angela, because most of the time, let's say you just go and buy one now, but it's I shouldn't say most of the time. The companies that provide you your oxygen will not sell you a concentrator, because they're getting reimbursed by Medicare for that, okay? So, but I'll come up with some more names for you. Okay.
In addition to the oxygen, if you know someone who is on oxygen or you're married to someone who's on oxygen, tell them not to change their oxygen to a higher level if they think they need it, unless their doctor tells them to. A lot of my patients will come in after their 6-minute walk test on their machine, their portable, and they'll say, oh, I'm so short of breath now, I have to turn it up. Don't do that. What you're doing is you're getting your lungs more adapted to that need of oxygen that's given to you through the concentrator, that they're not doing their work. Okay, because it's a drug, it's going to become ineffective if they keep upping their dosage without talking to their physician or pulmonologist first.
So by that same logic, should you not restrain from even starting on oxygen until you absolutely need it?
Unless your pulmonologist prescribes it to you, correct?
Yeah, but even if you pass the test, which I think I did, and a company called me the next day, I said no.
Correct. Unless your doctor puts in an order saying you need oxygen, go to this company and pick up a portable unit, or we'll send you one, or however it may be. Do not do it without their consent. If
Yeah, but
companies
even
are
if
calling
you,
you,
even if your doctor gives an order,
if they think you need it, do it, yes.
Do it.
but
Don't change the dose. Like, say your doctor
no,
says...
not change the dose. I'm just saying, why start if you don't, if you can get by okay without
You must have
it?
missed that little bit at the
That
beginning
same
too.
logic
Yeah.
that you said about diminishing the capacity of the lungs.
No. What happens, and Paige explained it, and I did too a little bit, whenever your oxygen drops and stays at that level that it's not supposed to be, usually below 89 to 90%. 88 qualifies you for the oxygen. You can qualify at 89 with
Right.
some different diagnoses. But what happens is your body wants to compensate for that. Okay? And so what happens is your heart and your lungs work together. And your heart's going to say, okay, not doing my job, bump, 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 because it's going to start beating harder and faster to try to provide you with that oxygen you're not getting. Okay? You don't want that. Because then it's going to ultimately lead to other complications. Cardiac complications. If you go on forever, I mean, it's just phenomenal the things it can create if you don't take your oxygen and you need it. You mentioned something else when you described yours, and it was really good, and I wished I had written it down. But anyway, she described it a little differently than I did, much more physiologic than I did.
Can I sum up what I think I just heard? If my doctor, or my hubby doctor says start on oxygen at X, how do you measure it?
Liters per minute.
At X liters per minute.
Yes.
then he should not ignore that advice. He should go arrange whatever to do the X liters a minute.
The doctor should
But-
actually do that for them.
But if he goes for a walk and feels he should not start increasing it himself.
Exactly. Do not self-increase.
Okay.
He should
You
talk to
should
his
stop and
doctor
do
about that.
Pursed-lip breathing. That's where the breathing techniques come in.
You can die.
I have a friend that.
Yes. You can over-oxygenate. It's a chemical that what happens is the blood volume, something with the blood volume changes, and it causes more damage.
Okay.
They call it oxygen intoxication sometimes.
Well, complete washout. But what really happens on your COPD patients is we are stimulated to breathe when our CO2 gets high. And it tells us, breathe, choo, 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 choo. When you require oxygen, you no longer are stimulated by your CO2. You're stimulated to breathe by your lack of oxygen. And so, let's say, okay, here's 2 liters of oxygen. She's doing great, her stats are good, everything else is good. 2's good, 4 must be better. No, because you know what we've done? We have now knocked out her drive to breathe. Because she's getting more than enough oxygen. So she just nicely goes to sleep. And stops breathing, your heart stops. That's why you don't want to do things like that. Okay? If you're walking and you're on oxygen and you can see you're getting short of breath, stop, do your breathing just like Paige said, and are we going over any closer as we are, and call your doctor when you get back to your house, or if you're going to see him in the near future, and say, okay, this is what happens when I walk, and let him decide whether you need to take it up to 3. And they even go in halves, some of these.
We also, at rehab, if we found that 2 liters is not enough and your stats on a treadmill are still in the 85, 86 low area, we'll call your pulmonologist and say, hey, we have her on 2 liters exercising. It's not enough. Our stats on our pulse ox are not getting a good reading. What do you suggest we do? They'll say, put her to 4. Okay. As long as you have permission to put it to 4 and her stats go up, we can do that. But we can't change your oxygen levels without your
And
pulmonologist.
we can't either.
Okay.
Great discussion. I loved it. Loved it.
Thank you.